Hi everyone, in this video we're taking a look at the components of your blood. So let's just say I take a needle, suck some blood out of the vein of your arm, and I throw it into a tube and we centrifuge that tube, we spin it down. What that does is it separates the blood out according to its density. So all the various components in the blood is going to be separated out according to their density. And we end up getting 3 layers within our blood. These 3 layers end up separating out sort of like that. So we've got 1 layer, 2 layer, 3 layers. Now the most superficial layer, this is going to be the components of the blood that are least dense. And what we call this layer is our blood plasma. So here we've got plasma. Now plasma is simply the fluid portion of our blood, and that fluid portion excludes the cells and the formed elements, which we'll talk about shortly. But it does have inside of it dissolved substances. Let's talk about that in a sec. Now, plasma constitutes 55% of our whole blood, 55%. In actual fact, you probably have around about 45 milliliters of plasma per kilogram of body weight. 45 mils per kilogram of body weight. So just keep that in mind. Now, with the plasma, what's inside of the plasma? A number of things. First thing that's inside of our plasma that you must know is it has water. Yes, that's unsurprising. Water, that constitutes 92% of the plasma. 92% of that 55% is water. What do you need to understand about water? Water is made up of H2O, right? Unsurprising. A hydrogen, an oxygen, and another hydrogen. What you need to understand about H2O is that the hydrogens have a slight positive charge and the oxygen has a slight negative charge. This is what makes water wonderful. It's recognized as the universal solvent, meaning that it allows things to be dissolved in it. That has to do with these charge differences. All right. So for example, if you have any ions within your blood, and we're going to talk about the fact that plasma does have a bunch of ions inside of it. If you have something like sodium, which we know has a positive charge associated with it, it's really going to love to associate with the negative oxygen. If you have some negatively charged substances, let's say like chloride, it's really going to want to come into contact with the hydrogen. What I'm saying is that any charged substances will be attracted to water and vice versa. This is important because if you have a cell, for example, and we know that we're going to have water inside of that cell and water outside of the cell. The water inside is intracellular fluid, the water outside is extracellular fluid. So this is important because the ion concentration inside versus outside can determine where water goes. So if all the sodium leaves your cells, for example, or let's say all the potassium leaves your cells, it's going to carry water with it, right? Which means you're also going to get water leaving the cell and you can get intracellular dehydration. Same can happen outside. If you don't have enough sodium outside your cell, well, the water's going to follow. You can also effectively, if you have too much water outside the cell, in the extracellular fluid, such as in the bloodstream, i.e. the plasma, you can give somebody a drug that allows for them to pee sodium out and the water follows. That's called a diuretic. That reduces the plasma volume, which will reduce the blood pressure. Because blood pressure is simply the force that's placed on the walls of the vessels, and that's going to be due to the amount of fluid inside of that vessel, right? So effectively, water is really important, and the charge differences are also really important as well. So 92% of our blood plasma is water. Next thing you need to be aware of is the proteins. Proteins constitute around about 7% of our blood plasma. Now, what proteins do you need to be aware of? 3 major groups of proteins. The first that you need to be aware of is albumin. Albumin. All right. Albumin is the most abundant protein that you're going to have within your bloodstream, within the plasma. It's produced by the liver and it has 2 major functions. First function of albumin is it helps maintain osmotic pressure. Now, we just referred to some things that can affect osmosis being the movement of water across a semi-permeable membrane, right? Albumin is no different because albumin's a protein, it's negatively charged. And because it's abundant, this negative charged protein can strongly influence the movement of water, particularly at the capillary. I want you to think about this, right? So if you've got a capillary bed where you've got the arterial end, and then you've got the venous end of the capillary bed, and then what you have is the capillary bed itself, where all the exchange happens, right? So here's our capillary bed. You've got cells outside that need to be fed. There are the nuclei of these cells. You've got blood that's entering this capillary, right? You've got blood that's entering. And inside, it's going to have things like cells. So let's say it's going to have white blood cells. It's going to have red blood cells. It's going to have platelets. It's also going to have ions like sodium and nutrients and waste and all those things. And because capillaries have holes in them, the pressure of the blood coming in pushes on the outside. That's called hydrostatic pressure and allows for the plasma to leak out. Now, what leaks out with the plasma? Not the cells, not the formed elements like the platelets, but nutrients and gases and ions. They get pushed outside. But what else is inside of this capillary that has not been pushed out? Proteins like albumin. Here's albumin right here, negatively charged protein. So if we push these substances out, which includes water, right? That's most of the plasma with its oxygen and nutrients, we're going to lose a whole bunch of our blood plasma out of the vessel into what we call the interstitium. We need to regain or reclaim that fluid. We need to reclaim that fluid on the venous end. And we do this because of the albumin. The albumin has a pull on the water at the venous end to help so that we don't lose all our blood plasma at the capillary beds, right? That's because of this albumin, this negatively charged protein. So that's the osmotic pressure that it maintains. Now, the protein pressure, the pulling force, we term that the oncotic pressure, all right? But it influences osmosis, which is the movement of water. Let's just say, I told you that the liver produces albumin. If the liver's damaged or doesn't work and we don't have any albumin, that means we don't have that inward pulling force and the fluid stays outside. We lose our plasma from our bloodstream and the fluid accumulates out here between the cells in the tissues, and that is what we call edema. So from having reduced protein, such as albumin, you can get edema. All right, so that's first protein that you need to be aware of is it has a second function. I forgot to tell you about. The second function is it's a carrier. Albumin is a carrier. What is it a carrier of? It is a carrier of any lipid-soluble substances. Lipid-soluble substances. So for example, we know that anything that's lipid-soluble is not going to like the water, right? Lipid-soluble means it is like fat. So it's not going to like the water within our blood, so it needs to be carried. It's not going to dissolve in it. Thankfully, we have albumin, so it can carry lipid-soluble substances. This includes things like drugs and hormones. And there's a whole range of lipid-soluble substances that it can carry. All right, in addition, other proteins that you need to be aware of, in addition to the albumin, we're going to have the globulins. Globulins. Now, not the globins, we're going to talk about the globins. They are the proteins inside of our red blood cells, but the globulins. And there's a couple of different types of globulins. So you've got your alpha and beta globulins, and you've also got your gamma globulins. All right? So the alpha and beta globulins, they are also carriers. And what are they carriers of? Not lipid-soluble substances, but metal ions. And these metal ions can include things like copper and iron. The gamma globulins, well, they make up IgG antibodies. Antibodies. And we know that the antibodies are really important in the immune system. They're made by the B cells, which are lymphocytes. All right? So these are important globulins. which are in turn important proteins. Last important protein you need to be aware of is fibrinogen. Fibrinogen. Now, fibrinogen I'm going to talk about in a future video. I spoke about it in the lecture on the clotting cascade, right? Fibrinogen is that final step. It is the clotting factor 1, right? And we know that it gets activated, chops off that OGN, turns into fibrin, and fibrin creates the fibers that create the clot in the clotting cascade. So if you want to review that, watch the video on the clotting cascade. All right, these are 7% plus 2%. That's 9%. We've got 99% here. What's the final 1%? The final 1% of our plasma is going to be that of, what do you think? Solutes. Things dissolved inside of our blood. That's the things that are dissolved in our blood. The solvent, which is water, dissolves solutes, and the solutes are a whole bunch, right? These include ions. Ions include things like sodium and potassium and magnesium and chloride. There's so many. You could say bicarbonate. There's so many ions, right? You've got nutrients. Nutrients include things like glucose and amino acids and fatty acids, right? So they're floating through. You can have waste. Waste like ammonia, or urea, which is the way that we actually excrete that ammonia. So you could say urea and creatinine. And creatinine is a byproduct of muscle metabolism. So you've got creatine, which helps give phosphate, which is, we know that ATP, adenosine triphosphate. You want to contract your muscles, you use a phosphate. We need to replenish that phosphate. Creatine holds spare phosphate for us and can pass it off. The byproduct of that creatine is creatinine. We need to pee that out. You're also going to have gases, and those gases include oxygen and carbon dioxide and nitrogen as well. And you're going to have hormones. And there's going to be a long list of hormones, which we cover when we go through the endocrine system. So this is plasma, right? That's what you need to understand about the plasma. The next layer, right, this little layer right here, this is called the buffy coat. The buffy coat. And the buffy coat constitutes around about 1% of our total blood volume. What's inside of our buffy coat? Let's take a look. A couple of things. First thing is leukocytes. Leukocytes are our white blood cells. And we've got a number of different leukocytes. You can remember them. Remember I said in the forum the mnemonic, right? Never let monkeys eat bananas. Never let monkeys eat bananas. That's the mnemonic. And it gives us our white blood cells in order of most abundant to least abundant. So we've got neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Most abundant to least abundant. What is their function? Well, okay, I'm not going to write it down, I'm just going to talk through it. Neutrophils are important. They are recruited in high abundance in acute infections. So they're usually the first to the site of infection. Their numbers boost up very soon after an infection, particularly bacterial infection, because they like to come in and engulf the bacterial infection or the pathogen that's at the site of infection. So they're the first called in. Lymphocytes include our T and B lymphocytes. So you've got T and B lymphocytes. They are really important in the adaptive immune system. T lymphocytes include cytotoxic T cells, helper T cells, for example. B cells create the antibodies, right, by creating plasma cells. Monocytes, they turn into when they're in the blood plasma, they're monocytes, but when they get into the tissue, they become macrophages, right? And macrophages are big eaters. So they engulf any pathogens or debris that need to be destroyed. Eosinophils and basophils are both involved in allergic response. So they're both high in allergic response. Difference, or some differences, is that eosinophils tend to bump up when there's a parasitic infection, and basophils are really good at releasing histamine. And we know histamine helps promote inflammation, right? So that's just a quick overview of those white blood cells, those leukocytes. But that's not the only thing that's inside of the buffy coat. The buffy coat also has thrombocytes. And thrombocytes are platelets. Now, what do we know about platelets? Platelets are made from something called a megakaryocyte. Megakaryocyte. And when you look at hematopoiesis, the process of making new blood cells in the bone marrow, if you have, let's say, the bone marrow, draw a dodgy bone here, looks like something off the Flintstones, as that bone marrow, which inside is going to be making, if it's a younger individual, in the bone marrow, the part of the medullary cavity of the long bone, you're going to have these megakaryocytes pushing themselves out. These are big cells, right? Megakaryocytes. So they bleb their body out like this, their nucleus, and they get chopped by these scissors, right? And it creates little fragments. And these little fragments are the platelets. So platelets are made from chopping up the cytoplasm of the megakaryocyte in the bone marrow. What's its job? Its job is to clot. We're going to talk about that as part of the clotting cascade shortly. So that's the buffy coat. What's the final layer? Final layer, this layer here. This is what we call haematocrit. This is our haematocrit. So the haematocrit is the percentage of red blood cells as part of the whole blood. So that's just red blood cells. So for males, it's around about 47% plus or minus 5%. And for females, it's around about 42% plus or minus 5%. That should be the normal amount of red blood cells or haematocrit. That's important. And the reason why it's important is because of this. Because it contains erythrocytes, which we know are red blood cells. Red blood cells, what are they made up of, right? So you've got a red blood cell here. It's going to be around about 7 micrometers in length. It's going to be around about 2 micrometers in width. Really small, right? Really small. We make about 2 million of them a second. They're so small, right, that there are capillaries. I drew it up before. But there are capillaries that are so narrow that it only lets red blood cells move in one at a time. And even then, some of those red blood cells need to be very bendy and fold themselves through. So they have to be small because some capillaries only let them through single file. Now, inside of a red blood cell, it's pretty much just filled with hemoglobin. There's no nucleus, so they can't repair themselves, which means they only last for 120 days, and then they need to be recycled. Where do they get recycled? They get recycled at the spleen predominantly, but they can also get recycled at the liver. Now what happens is in the spleen and the liver, it's like a gauntlet, right? Like the show Wipeout. Remember the TV show Wipeout? Get people to run along the bouncy balls and it's the water course and they fall off into the water. If they're fit, they get through. If they're not, they get knocked off, they get destroyed. That's what happens with red blood cells. They have to go through this gauntlet. If they're not bendy and flexible and dynamic, they get destroyed. What's inside of the red blood cell? A couple of important things. The major thing is the hemoglobin, right? So I'm going to get rid of this. So if you have a look inside of a red blood cell, you've got your hemoglobin. So let's say that's hemoglobin. Hemoglobin's made up of alpha, 2 alpha in actual fact, and 2 beta hemoglobin, right? So these are globin proteins. So these are the globins, not the globulins, but the because I said alpha and beta globulins. Don't get it confused with the alpha and beta globins. Alpha and beta globulins are carrier proteins. These are globulins. Inside of the alpha and beta globins, you have heme. There's a heme, there's a heme, there's a heme, there's a heme. So that is heme. Now, heme is a molecule that has an ion, I know it's getting confusing now, as the crown jewel in the center of it, right? So that is an ion, which is Fe 2+, right? That carries the oxygen. The oxygen, the O2, binds to the ion. So what you get is 4 oxygen molecules per hemoglobin. And we have 250 million hemoglobin per red blood cell. So 250 million times 4 is 1 billion. We have 1 billion, that's probably too old of a reference, Austin Powers, 1 billion oxygen molecules per red blood cell. That's important because we need to know the hematocrit. If it's too low, we're going to have less hemoglobin. We're going to have less oxygen. This person might be anemic. So low hemoglobin might indicate anemia. Important indication. All right, hopefully that helps. That's the components of blood.